there are a number of treatment options today that are available for patients with HCM. Hello, I'm Maron. I am the director for the Hypertrophic Cardiomyopathy Center at Lahey Clinic. And so we can really provide the vast majority, if not close to almost all patients who develop symptoms in HCM, an opportunity to improve with that with either drugs or invasive therapies. So the drugs, surgery, and ablation are what we have available to help treat symptoms if they develop in patients with HCM. Whether to start with medicines versus, invasive options like surgery or ablation, are discussions that individual patients should have with their, HCM care provider. We generally start with medicines first, generally, to see if those are successful enough at improving the patient's quality of life. And if they're not, then we've got the option of invasive therapies that are often very effective. So let's talk a little bit more for just a second about therapies. Most of the medicines that we've been using for the vast several decades in HCM are medicines that we've extrapolated from other heart diseases and have used them in HCM, but we actually have now the development of disease-specific drug therapy in the form of a new class of drugs called cardiac myosin inhibitors. There are now 2 drugs that are in that class that are approved, and those 2 are mavacamten and aficamten. And so we've got 2 drugs now which are very effective at making patients feel better and function better who have obstructive HCM if the first-line drugs like beta blocker or calcium channel blockers are not effective enough. So patients really have, in that sense, lots of options here to help improve their quality of life. And the important point is really then that patients should be encouraged, obviously, by that, and really should have a conversation with their provider if they're one of these patients who have symptoms related to obstructive HCM about which of those options may be the right one for them on an individual basis.